That I want to extend my condolences to the family of Dulciana Carter, and indeed my sympathies to all of the families that have been impacted by this whole saga. It is a scandal, it's a national scandal, it's a huge issue that needs to be dealt with, and where we need a timely response to it, not yet another example of putting something into a review and kicking it down the road. And my fear is that that's what's going to happen. Both you, Minister, and Minister Naughton talked about the importance of having an appropriate response when things go wrong, and ensuring that the response is honest and open and transparent. And of course there should be full disclosure and a candid response. I'm concerned that we haven't got that. The first I heard of this, I have to say, was last Monday, when the article in the Ditch was brought to my attention. And that was Monday morning, and then around lunchtime we got further information from the HSE. And we have to ask, if it wasn't for the article in the Ditch, when would we have heard about all of this? I also have a concern about the response to that and how this was announced publicly last Monday. It was very much announced on the basis that there was a single issue here, and it was all about an individual consultant. Now, that's how the HSE press statement was framed. It was how, interviews spokesperson for the HSE framed the whole thing. It was an individual consultant that this whole thing was about. We were also told that the two reviews that had been completed, the internal and the external, would be published that day. It turned out they weren't published that day. In fact, it was a HSE report on the two reviews that was published that day, which essentially filtered the reviews. And when myself and others called for those reviews to be published, we were told they couldn't possibly be published because of confidentiality and because of the fact that people who participated in them had been assured of confidentiality. And of course we know that wasn't the case. And further to political pressure being applied throughout Monday and Tuesday, finally then on Wednesday, the two reviews were published. So I have big concerns about the handling of this at official level and how it came to be announced and the framing of it. Now, when we did eventually get to see the two reviews, there was the internal one, which was basically, I don't know who carried it out or anything, but it was basically a statistical review. The external review didn't refer to any individual consultant, and I think that's a notable point. But it did make 50 different recommendations. It didn't outline problems that were identified, but you could read between the lines from the 50 recommendations about where the problems were within Temple Street. And, there were pretty basic things that were identified that needed to be addressed. There was things like the need for a clinical specialty lead for orthopaedics, that the operating theatre governance committee needed to be put in place. Why wasn't that there already? About the need to develop a quality improvement team, to strengthen a quality improvement programme, to establish culture of high reliability that demonstrates consistent excellence. I mean, surely you would expect that these things would have existed already. We needed evidence-based clinical guidelines and checklists. Like all of these things relating to the operation and the management of Temple Street. And there's no talk about any of this in the official response to this issue. So quite clearly it was a much wider issue than one individual consultant. And that's why, there are concerns being expressed that there is an element of scapegoating going on here. So I'm asking you, Minister, when are you going to tell us what Temple Street is doing in relation to those pretty severe criticisms, implied criticisms, and clear recommendations about the functioning of that hospital? Has Temple Street management taken that on? And are they going to respond to it? Of course, the other thing is that we had 3 reviews already, none of which were published. There's another 2 now, so we're talking about 5 reviews, and this latest 5th review potentially taking up to a year to complete. So, when are we going to know the facts of this, and when is action going to be taken? And in the meantime, of course, the reaction of parents is very understandable, parents and advocacy groups, because they don't know where they stand. They're in a limbo now at the moment. They don't know if all of the surgeries have been stopped in Temple Street. They don't know, are things safe or not? Has CHI got the ICU beds to carry out surgeries elsewhere if they're stopping in Temple Street? Essentially, there's a need for an interim plan. So, parents don't, it is important that we find out what happened in the past and that there's a thorough review carried out. But what's going to happen now? Those parents who were expecting their children would be having their surgeries, today, next week, next month. What's happening to those? So you need to produce an interim strategy or an interim plan in relation to that. And of course, it's not just those children that had spinal surgery. There's a whole lot of other surgeries that the surgeon in question had carried out. And what about the concerns of those families? When are they going to be addressed? And indeed, there are adult patients of that surgeon as well who don't know where they stand. So what we need now, I welcome the fact that the Taoiseach has now agreed to meet them. To meet the advocacy groups. But it is absolutely critical that they have a clear input into the terms of reference now. They know what's happened in the past. They are now, in a situation where trust has broken down. And Minister, the most important thing you have to do is to restore that trust.
Now in our next slot,